Haroon, Faraz, and Mike Gibson talking to you about the Guardian device, a device that you implant like a pacemaker, and it buzzes and alarms if you're having a heart attack. FDA approved. Haroon, you're going to be leading the post-approval trial. Talk to us about your experience with the device and what you have planned.
Yeah, absolutely, Dr. Gibson. We know that about 40% of the CHD events occur in patients who have prior disease. And I think that is something which has been known to the cardiovascular community for many years. In spite of that, in spite of all the advancements in preventive measures, majority or 2/3 of these patients don't show up in a timely fashion because of the variation in symptoms, clinical presentations, access to the ER, urgent cares, and oftentimes by the time they come to the cath lab as an interventionalist, their time has spanned where a big amount of the myocardium is already injured. And so that end, I think the high risk patients who have these moderate disease in the coronaries, which right now we don't have the definite answer of what is the best strategy, monitoring and keeping a high alert on them using a technology like Guardian Angel potentially will change the landscape of recognizing and treating them early on so that you protect the myocytes from getting injured and translating into long-term morbidity outcomes.
And what are your plans for the post-approval study?
So I think it's important as the community. Currently, we don't, as an interventionist community, we don't have that mindset of proactively keeping a tool to keep these patients on a surveillance program. And for the post-approval study, I think first order of business is to have a mindset shift to recognize that this disease, which creates the morbidity, is actually lying in front of us. And if we don't proactively create a surveillance program using this technology, we will be behind the curve. We'll always be catching up and then increasing the burden of heart failure, and then dealing with all the bag of issues that comes with morbidity that comes with heart failure. So I think this technology is a very powerful tool set, which in the current space, I don't think the community has yet developed a mindset of proactively. I give the analogy to my patients that it's like living in a nice house and not having a security system, right? And how often are you going to use the security system, or how often do you drive a car without an insurance? And we all have insurances, and I don't know when was the last time you had a car accident where you required the insurance or used that insurance. And I think that's what I tell them, that this is a surveillance tool which makes sure that if a bad catastrophic event happens, we catch it in a timely fashion where we can prevent the injury from extending to a point where it harms you in the long term.
Great. Well, thanks so much for taking up the charge to bring this home, do that post-approval study. Thanks for chatting with us today, and thanks to all of you for listening.
Absolutely, my pleasure.